Doctor, if we're not sure exactly how breast cancer forms, do we have an idea of who might be at risk? What sort of populations might be more prone to it?
The American Cancer Society has a long list of conditions or things, risk factors that are identified as risk factors. One is like age. We know that the more aggressive cancers start after the age of 55. We know that white women tend to have more breast cancer than African American women, even though that African American women, when they get cancer, they tend to have a more aggressive type of cancer. Family history is the one that we always talk about, except maybe less than 20% of cancers, of women that get cancer have a family history at all. There is BRCA gene testing. You know, we look at certain populations to see if they have this gene called a BRCA gene, which stands for breast cancer, for the breast cancer gene. We know that less than 5% of people have the gene, and even of those people, not all of them develop cancer. So there's lots of risk factors that are around for cancer, but just because you have those doesn't necessarily mean you're going to get the cancer.
Along the same lines, then, are there things that people can do, that young girls or women can do to better their odds as they go?
Yeah, I'm really obviously a very big fan of breast thermography. I just think that infrared imaging is the way to go because it's non-invasive, it doesn't cause pain, it's no compression, and you can start screening women as early as 40. Actually, you could start screening women as early as 30. There's another technology that we use in our office exam to assess the health of your breast ducts, which is the most common place where breast cancer develops. It's a technology that uses a warm water massage and a suction, and the suction is the same level of pump as what a breast pump is that women use when they are nursing and they're pumping to store their breast milk. So it's not a painful test. It's actually a 5-minute assessment. They put the halo, the suction cups on both breasts, push a button on the machine, and 5 minutes later there's a warm water massage and a little bit of suction. And about 50% of women have nothing that comes out, so that's considered a normal screening.